Hi, my name's Christy from Edwards and Walker Opticians. I just wanted to speak to you guys about age-related macular degeneration today, also known as AMD. You guys may know people that have referred to themselves as saying, I've got dry AMD, I've got wet AMD, I've got macular, things like that. So I just wanted to go a little bit more in depth to sort of explain what it is from our point of view and what you can do to help detect it or to help sort of reduce the likelihood of you getting it. So the macular area is where you get your finest, clearest central vision, basically. And if that macular area is affected, it affects what you see bang on centre in your vision. So age-related macular degeneration, the clue is in the name, it's age-related. Fortunately or unfortunately, we are living a lot longer than previous, and it seems that our eyes weren't meant to live that long, which is why we're seeing sort of a spike in presentation of macular degeneration or AMD. So all AMD is basically wear and tear of the retina. The retina, there's pumps that sort of control the nutrients and things sort of going back and forth through the layers of the retina, and those pumps basically as time goes on just start to become a little bit less effective in pumping sort of the nutrients round and keeping the sort of retina and macular area at its best. And what that can show up as is sort of pigment changes on them in the macular area, in the central vision that we can see. And then what can happen is, at that stage when we're just sort of seeing those little pigment changes, some wear and tear of the macula, we would term that as dry macular degeneration. The reason it's termed as dry is because there's no fluid involved, there's no liquid involved at that point. So a lot of people probably will have heard of the term as wet macular degeneration, and what that means is that there's a bleed involved at the macula. As well as there being normal wear and tear, there's a bleed involved, and when there's a bleed involved, your vision can drop dramatically. If you've got dry macular degeneration, it is a slow progressive condition, and it does affect your central vision, but over a much longer period of time than what a wet macular degeneration patient would experience. So when you have a bleed at the macula, that means you have a sudden drop in your vision and you know about it. So for dry macular degeneration, at the moment there isn't any form of treatment for it. There's things that you can do to sort of decrease the likelihood of you getting it. There is a hereditary element to it, but the things that you can do to decrease the likelihood of you getting it is increasing the amount of dark green leafy vegetables that you eat. So by that I mean kale is meant to be fantastic for the macular area, spinach and broccoli. So there's a few sort of key nutrients for the macula are known as lutein, zeaxanthin and mesoxanthin. You can also buy them as vitamin supplements from your local pharmacy, but dark green leafy vegetables are absolutely fantastic for the macular area. The more that you can include in your diet or your child's diet now will definitely help you in the future to hopefully sort of, number one, hopefully not get macular degeneration, but if you are prone to having it for whatever reason, it can delay the onset of it for you if you've got those key nutrients nourishing the macular area. So like I say, there's no treatment for the dry macula. It's just sort of things that you can do to delay its progression or just delay getting it, and that's the diet and the vitamin side of things. Also, UV light is known to accelerate macular changes, so the less UV light you have going in, the less damage you will cause to your macula, as well as the lens of the eye that's discussed in a previous post about cataracts. So what that means is having UV coating on your lenses and making sure that when you are out and about and it's bright outside, that you've got good UV protected sunglasses. The wet macular degeneration, that sort of is usually spoken about a bit more, is the one that can be treated. But some patients feel that maybe that's the better one to have. Entirely not true. Yes, it can be treated, but the drop in your level of vision is very dramatic. It's phenomenal change in your vision. So really, if you're going to have one of the two, you don't want to have the wet macular degeneration. If you are unfortunate and then that does happen and you do have a bleed at the macula, then there are treatments available to try and reabsorb the bleed as soon as possible, but it is time critical. So if you are noticing any changes in your vision, sort of where you're getting sudden, sort of you're waking up and you're thinking, well, you know, I can't see out of that eye, you know, things have changed, please don't leave it, please go in and see your optician. Now, there are technologies available that can scan the macular area and sort of start to look at picking up any sort of defects that might be occurring in sort of the lower layers of the macula up to 5 years before they present at the surface level. So current methods in the majority of optician practices can only see the first layer of the retina as we're looking down on it. There's 8 layers behind that layer. The OCT technology that's available now can scan those layers, and like I say, if there's any sort of changes that are occurring in the macular area, in those deeper layers, that can sort of alert yourself and myself to that something's happening there, and then we can advise you appropriately in terms of what you could be doing to try and minimise that risk. The reason, going back to the wet macular degeneration, the reason that it's known as wet, because like I say, wet indicates there's been a bleed. That bleed occurs because there's new blood vessels that are sort of developing in the lower layers of the macula, and those new blood vessels are very weak blood vessels. And as they develop, because they are weak, they are prone to bleeding. And that's exactly what happens, is that those new blood vessels bleed and drop your vision. Again, with the OCT technology available now, we can sort of start to detect if that blood vessel formation is occurring in the deeper layers, and then sort of get ophthalmology advice accordingly to see whether there can be anything done for that to stop it progressing further through to the sort of the top layer of the retina, where you'll sort of be affected substantially in your vision. So the main sort of take-home points really for macular degeneration is dark green leafy vegetables, possibly vitamin supplements if you're not a fan of the dark green leafy vegetables, and then thirdly, UV protection. The less UV light you have going in, the less sort of macular changes will progress, and the healthier it is for your eyes. It's exactly the same as it would be on your skin, when you're putting sort of suntan lotion on to block the UV rays. You need UV protection on your eyes to stop any sort of damage occurring there. Thank you for listening. Any questions, any queries, please message us on Facebook or drop us an email or book in to see us. Thank you for listening.